Good evening. Today is Thursday, April 29th. Welcome to a special Facebook Live community briefing on the COVID-19 pandemic, hosted by the Stanislaus County Office of Emergency Services. I'm Amy Collier-Carroll, Stanislaus County's Public Information Officer. I'll be moderating tonight's live discussion, which will be recorded and later posted to the Stan Emergency Facebook page and YouTube channel. I won't be on camera tonight, but you'll hear my voice as I direct your questions to our panelists. Several questions were submitted this week in advance of today's broadcast, so we will not have time to address viewer questions during the broadcast. However, our staff will answer your questions that come in through Facebook, and we also want to make sure the community is aware of our COVID-19 call center, which can be reached at 209-558-7535. Tonight, Stanislaus County Public Health Officer Dr. Wei Shampayan is with us. We call her Dr. V. She's joined by County Supervisor and Board Chairman Vito Chiesa. And Modesto City Schools Superintendent Dr. Sarah Noguchi is here this evening as well. Let's begin tonight's discussion with a public health update. Dr. V, the last time we hosted a Facebook Live community briefing was fall 2020, and we recently passed the 1-year mark since the declaration of the COVID-19 emergency. A lot has transpired in this time. Can you provide a quick data snapshot and share what you're seeing now with COVID-19?
Yeah, so we're continuing to see cases every day. I'd say we average somewhere between 50 and 70 cases each day. We've had over 54,000 cases that have been diagnosed in our county with just over 1,000 deaths. And every day, again, we're seeing about maybe 3 deaths each day. So we're still seeing transmission, we're still seeing hospitalizations, and we're still seeing deaths.
Thank you, Dr. V. You mentioned this week in our Board of Supervisors meeting that you believe Stanislaus County could be on the verge of another surge. Can you explain why and how we can avoid this?
Yeah, there's a couple reasons that I think it's coming for us. One is the probably least important one is we look at the 1918 pandemic. We followed that very closely. And so there was that first surge in the spring, summer of the first year. Then there was the really large winter surge, which is exactly what we've seen so far. And then they again had a smaller spring surge. So that's one reason that I've been kind of looking at what's been going on. And then if you look around the world and you follow the way the waves have come across the world and across the United States, it's usually gone up in Europe and then the eastern United States and then kind of waved across the country before it hit the West Coast. And so we've seen that happen again. We saw the increase in Europe. We've seen the increase in the West Coast or the East Coast. And then it's come over and now it's finally gotten to the West Coast. We've seen increases in Washington and Oregon. So I just don't have any reason to believe, despite our really big vaccine effort, that California won't see an increase in cases. What I really hope is that with this high vaccination rate that we're getting, I mean at least 50% vaccinated statewide, and then just looking at how it has happened in other places, I'm hoping this surge is smaller than the winter surge. I expect it to be smaller.
Thank you, Dr. V. Let's go to Supervisor Chiesa. Supervisor, many of our local families have struggled over the past year, not only with loss of loved ones, health concerns, school closures, or childcare issues, but job losses and the economy have all been significant cause for concern. What are the most pressing issues you hear from your constituents?
Yeah, thank you, Amy. And I would tell you that, when you look back in the last year, we must acknowledge that everyone has been touched personally, directly or indirectly by this pandemic, whether it's physical health, mental health, or loss of employment, something to do with job status. And it's really amazing. As I talk to constituents, it's surprising how passionate they are about this issue. I represent people who think that this pandemic, that we didn't handle it correctly, that we weren't quick enough, that we should have done more. And then I have a lot of people that I represent that tell me that they've lost their jobs and or they've lost their business and that we've gone way too far. So it's interesting, it's very passionate. But what I do know is that we're very resilient. And I try and remind people we can see light at the end of the tunnel. And with the vaccines here on the forefront, I just keep reminding them that we're moving forward.
Yeah, very true. You just mentioned loss of business, and my next question relates to that. Many businesses have gone under in the past year because they couldn't survive the closures and modifications mandated by the state. Are there any special resources you're aware of locally for business owners who are struggling or employees who are out of work?
So Stanislaus Workforce Development is really the portal into the county. They've ran some of our business grant program, and they've got people just waiting to help you out, whether it's workforce training and or putting you in touch. So I would tell you there is a website. It's stanworkforce.com. I would tell people to start at that point. They can also call 211 to get that. I think it'll show up on the screen here. But they are really, there's so much money available through the state and federal government right now for small businesses. And I don't want to leave any of that on the table. And I encourage people to call and or get on the website for Stan Workforce Development and seek out that money.
Thank you for those resources. Let's go to Dr. Noguchi with Modesto City Schools. Dr. Noguchi, students in your district were invited back to school after almost a year of distance learning, and for some students in secondary schools, over a year. How's it going? Can you talk about some of the challenges and also what has pleasantly surprised you through all of this?
Certainly. Thank you, Amy, and good evening. First off, our elementary school, we were happy to bring our elementary kids back roughly in November. So they were out of school for about 6 months. Certainly not a good way to start school. Our secondary schools just came back this last couple weeks, and actually Monday they were back 4 days. So yes, our secondary were out for quite a long time. However, during that time, kids were still engaged in learning, as we all know, through a distance learning format. Is it where we want to be? Absolutely not. It's very difficult for our teachers, it's difficult for parents, it's difficult for our students. However, we are working towards this summer and next year with some mitigation strategies that we believe is going to help our students. As far as challenges, many challenges, you said it in the last question, it's what do we need to do to be able to get businesses open, or what do we need to do to get schools open? And it was truly a team effort with all the different health and safety mitigation strategies to get our schools open. So I'm very confident that our schools are a safe place for kids and a safe place for our adults. As far as the challenges is really around COVID. It's contact tracing. It's looking at all the mitigation strategies. It's trying to figure out the best way to engage our kids through the computer and also help to support those kids that we know that are not engaging. And so really those are the challenges. I'm pleasantly surprised that over this last really year and a half, and I see it in the community as well, and that is everyone coming together, pitching in. They're not looking at job descriptions to figure out what they're supposed to do or not do. It really has been a team effort, and so pleasantly surprised on that front. But I'm also pleasantly surprised at the understanding of parents, and it's been very difficult for parents this last year and a half. Pleasantly surprised that they've been supportive of us to the extent possible. And also students. I have just recently this week looking at student achievement data. It's certainly not where we want it to be, but we do know kids are learning, and so we're hopeful for that.
Thank you. We'll stay with you for just a minute here. Earlier this school year, districts really tried to accommodate what the families felt was best for their individual circumstances when it came to going back to in-person learning versus distance learning. How many families chose to keep their students home?
We've been very sensitive to parents and parent needs, and also students and students' needs. When we opened up in November with a hybrid, with a 2-day model for our kids, we saw that not very many kids at the elementary level showed up initially, but as they began to get more comfortable, and also the surge was decreasing and vaccinations increased, we saw many more kids coming back into school. When I take a look at the attendance rate just this last week for a 2-week period, roughly 30% of our kids have decided at this point to not come back to brick and mortar to this point. About 40% of our junior high, and a little over 60% of our high schoolers. Our high schoolers are staying at home. However, this week, because we are on a 4-day-a-week schedule, I anticipate that is going to increase for the secondary level.
It's interesting. So, how have students performed academically this school year compared to other years? And what resources will the districts provide to make sure that the students don't fall way behind?
We recognize that that our students did not perform to the level that they have in the past. There's no way they could have. Was there a percent of students that excelled? There was. So certainly, but I would say it's a smaller portion that excelled. The work that we've been doing over the course of the last 2 months, and this will happen into the summer, is really looking at and building programs to mitigate the unfinished learning from this last year. So starting from intercession, which we did in the winter and the spring, also summer, and then again next year in multiple structures, we are going to provide students opportunities not only to increase engagement with other students, but also ways in which they can go back and learn what they didn't learn this year with the unfinished learning.
Thank you. That's good information. Let's go back to Dr. V. Dr. V, we are currently in the red tier, identified as substantial spread in our county, after months of being stuck in the purple, widespread transmission tier. Do you see us moving into the orange, less restrictive tier soon? Any predictions on that?
Yeah, I get asked to predict what's going to happen in the future a lot, and it's really very difficult to do. So our case rate right now is really very stable to decreasing, and it decreases very slowly. So if we continued on the same decrease, I would think we'd get to the orange tier in 3 to 4 weeks. That's about the rate at which we're decreasing. However, if we do start seeing an increase in cases, which we may, then we probably won't get to the orange tier, because I believe that will happen, if it's going to happen, before 3 to 4 weeks is up. So it's really, I really can't say. We're going to just have to wait and see how this goes.
Thank you. Dr. V, Governor Newsom indicated not long ago that the blueprint for a safer economy and associated tier structure for counties would go away on June 15th if certain criteria are met. A resident posted this question to our COVID info line. Does the county have the guidelines and/or measures we will be enforcing when California fully opens on June 15th? So what will the new structure look like, and what criteria would we have to meet?
So we do not yet know what the new criteria or structure are. I do know that the state is working on that. To date, as I hope everybody knows, all the guidance has come from the state, and so it's really up to them to define what they're going to do. We don't have that flexibility at the lower level as the local level right now. So we're waiting to see what they're doing. I do know they're working on it very hard. I don't know what it's going to look like. But I think the biggest criteria that's really being looked at is hospitalizations, because as we know, a lot of this has been about maintaining our healthcare system and making sure that hospital beds are available when people need them, whether it's for a COVID need or not. And so looking at the hospitalizations at that time when we get into June, seeing how it's going, and then I think the decisions will be easier then. And so they're stuck trying to predict the future a bit, what it's going to look like June 15. So I think we're going to have to wait and see. I do know that makes it very difficult to plan. But one of the things I would say is I talk a lot about the Swiss cheese model of prevention, and I presented that a few times at the Board of Supervisors. But it's really about layering on your prevention. And people are getting more choices now, and as we move forward, there will continue to be more choices in the activities you want to do. And if anything you remember, it's just that you want to layer on a few levels of prevention. So distancing, ventilation, such as being outdoors, much better than being indoors, wearing a mask, getting vaccinated. Those are the layers of prevention that you can use to protect yourself. And so when you're making choices now and in the future about what you're going to do, really continue to think about that, and it will serve you well.
Thank you, Dr. V. That's really helpful. And we're going to go to Dr. Noguchi now, because I know with students back in the classrooms, you're indoors and it's difficult mixing with people outside of your family. So have you seen a lot of COVID-19 cases or outbreaks?
Back in November, we put up a data dashboard on our website. So we've tracked all of the positive cases either with students or with staff from the beginning. And so for any parents or community members that would like to know the data, they could go to our website and see the COVID dashboard. Certainly, we saw an uptick as the case rates went up in the county. We saw it also go up in our schools. And as the case rates went down in the county, we saw them go down in our schools. Recently, we have seen an uptick, and that is because of high school sports and junior high sports as the kids are getting out and mixing and mingling, and so it's causing room for infection. Additionally, we now have some sports that are indoors, and unfortunately, that's not a good recipe for mitigation, if you will, and so we're doing everything that we can to adhere to the guidelines that have been put out by the state. One thing that I can say that we have done over this wintertime with the help of the state funding, and that is really reworking our HVAC systems to have certain HEPA filters in all of our schools and all of our gyms, in addition to actually having an architect coming in and doing studies on the air and how long it takes to recirculate the air. And so we're in good shape. For folks that are interested in just following the cases, they can take a look at the website.
Thank you. I think a lot of people are curious, what happens when there's a positive COVID case reported at school? What does that look like?
Okay. So, we've gotten really good at this now, right? So you have a positive case. That positive case is reported to their direct supervisor or their principal. That person then works with our health officer in our district that works with public health. We take a look at where the cases happen at school, and then we do contact tracing, and all either staff or students that were around a positive case are then quarantined for 10 days. And then the whole system just turns back around when we have another positive case. So it's a well-oiled machine by this time.
Not easy to keep up with, I'm sure. We know that students going to school in person are required to wear face coverings. This is probably more difficult to enforce the younger the students are. One social media follower asked if it's safe for preschool-aged children to be in classrooms with no masks.
This was one of those things that surprised me, going back to your very first question. When we heard that age 2 and older were going to be required to wear masks, this was way back in the fall, I honestly thought it was absolutely ludicrous and it wasn't going to happen. However, if you go into our preschool or our TK or our kinder, you can see the kids are wearing the mask. It's just part of what they do. Once they're trained, they don't know any different. As far as the safety, we know that masks are one of the mitigating factors. And so it's safer to have the mask than not have the mask, especially when you're indoors. So I was just in the classroom yesterday, and out of the kids that I saw, there were only about 12 kids in the class. Everyone had a mask on, and they weren't messing around with it. And it looked like it was just part of their day.
I guess they get used to it just like we have, huh? Mm-hmm. Let's go to Dr. V. Dr. V, let's talk about vaccines. This week, the Western States Scientific Safety Review Work Group concluded the Johnson & Johnson Janssen vaccine is safe and effective and recommended resuming use of the vaccine for all eligible Californians. Is Stanislaus County vaccinating with Johnson & Johnson currently?
Yes, so there are providers who have restarted giving the Johnson & Johnson vaccine. We, as public health, have not yet started because our clinics were all planned out already for this week. And so we're looking to include the Johnson & Johnson again next week as we plan our clinics. So it's more of a planning issue than anything else.
Thank you. And with so many different options on the market, right, at least 3, I guess, what do we need to know to decide which vaccine is best?
So we have 3 very effective vaccines. As I've said, hopefully you've heard me say, all of them are very, very protective against hospitalizations, and all of them are very, very protective against death. So this is great news for us that we have 3 very good approved vaccines. 2 of them use the same technology, that messenger RNA or the mRNA that you hear all the time about. And the only thing that really happens that we've seen so far out of about 200 million doses given in the United States is, of course, the allergy that you've heard about. The Johnson & Johnson, to talk a little bit about the pause, what was seen was some clotting with a low platelet, which is unusual. Usually when you clot, your platelets aren't low, and it's actually there's an antibody that develops against the platelets. So it's a different type of clot than what you usually hear with a deep vein thrombosis in your leg or something like that, what we call the DVT. So that has happened, and it's primarily in women. So far, they identified 15 cases. It was actually a really great catch of our safety surveillance system. So I hope it makes everybody feel very comfortable with the safety surveillance system, that the pause was done with 6 cases identified out of the 7 million doses given. It was 7.9, I think, so closer to 8 million doses given. So with the 6 doses, they paused it. The 6 cases, they paused the vaccine. And then they identified a few more cases, so it was up to 15. And all of these 15 were in women. That doesn't mean it won't happen in men. And most of them were in women under the age of 50. And so the case rate comes out to be about 7 per million doses. So it's very low, actually. It's lower than what we've seen with clotting with the COVID disease. And so as we look at what these data mean, so with the disease, you're more likely to get clots than you are with the vaccine, and so the pause is resumed. But if you're a woman between the ages of 18 and 50, you might consider taking the other vaccines instead, because they do not have this risk. It's still safer to take the vaccine than not take the vaccine, but people need to know what they're taking and look at what they think is the risk versus the benefit. The benefit of taking the vaccine is you become immune, but you also become immune faster, because remember, it's the 1 dose. And so it's 2 weeks after that 1 dose instead of waiting 2 weeks after the 2nd dose, which is 5 or 6 weeks. So you have less time of which you might get COVID-19. So there you can weigh the risks and the benefits and make your own decision, but all are approved in the United States.
That's good advice, Dr. V. We know we have now 5 COVID-19 variants confirmed in our county. Are we protected from all of them if we get vaccinated?
So yes, you are. That's been very clear from the data so far. Still very good protection against hospitalizations and deaths. So it doesn't matter which one you take for any of the variants so far.
Okay, one more question for you before we go to Supervisor Chiesa. On April 1st, the county made it possible for anyone who lives or works here, 16 years of age or older, to get a COVID-19 vaccine. To date, only about 29% of those who are eligible have been fully vaccinated in Stanislaus County. Why do you think the numbers are lower here compared to other counties?
I think there's actually a couple reasons for that. When we first started vaccinating, as people can remember back December, January, it was healthcare workers. And then it expanded to people 65 and older. Well, as we look at the population of Stanislaus County, we have fewer healthcare workers. I think people know that. We don't have one of those big centers. Think of San Francisco with the UCSFs and the Stanfords in the Bay Area, and many big centers that have many healthcare workers. We have fewer healthcare workers, and we're a younger county, so we actually have fewer people 65 and older. And so as the first doses went out, they went to other counties, more per population than Stanislaus. So we've been behind for a while, but I think we're catching up and vaccinating at the same rate. So we will get there. It's just we have to continue vaccinating and taking the vaccine as it becomes available, and we will catch up.
Yeah, that's good information. Supervisor Chiesa, okay, the county is about to receive approximately $108 million from the federal government under President Biden's American Rescue Plan Act. What is this funding intended to do locally?
So things are still fluid, first of all, and they're still writing the rules. But from what we've seen so far, the $106 million is more flexible than the coronavirus relief funds or CRF funds that we have already received. I think there's more flexibility in paying back lost revenues. There's the ability to go into infrastructure. It's just more flexible. And on top of that, we have until December 31st of 2024 to spend that money. And as good as it sounds that you have to spend money right away, it doesn't necessarily make for good governance. So I think the flexibility, it looks like it's going to be good. We're expecting within 2 weeks, half of the money to hit our coffers and to the Treasury, and then about a year later, the other half. And so I'm looking forward to more guidance. As far as what Stanislaus County, how we're going to handle that, I think we're going to have public input, but I think what will happen is first the board members will put them into large buckets. And I'll use an example of infrastructure because that's one of the uses. We'll put $20 million in infrastructure, and then we'll listen to the public. That could mean broadband, that could mean sidewalks and unincorporated islands, that could mean bridges for that matter. And I think we'll have an opportunity, the public will have an opportunity to discuss that as well as the board. But it's something good. And there's about $435 total million coming to Stanislaus County, which is a lot of money between the schools, the cities, and the county. The cities the first time didn't get a direct allocation, so this is better. There's a direct allocation. I think the city of Modesto is getting about $46 million, and Modesto City Schools, as an example, is getting $92 million. So a better problem to have money to try and deal with, and I think really when you look at this public health crisis, we still don't know where it's going to end, and there's money that needs to be spent continuing to keep people healthy.
That's going to be a huge benefit to our community. Last year, the county received CARES coronavirus relief funds, and you mentioned that, CARES CRF funds, to support our local COVID-19 response. Where was that money used, and how will this be different?
So that money was split, not quite 50-50. I think we had about $58 million that went into the public health system or associated county departments. Those went for things like contact tracing, testing, vaccines, the Emergency Operations Center trying to get information out to folks, standing up websites. And there's still we still have some money in reserves there. But again, since we don't know when the end of the pandemic is, we know we're going to continue to spend money. Maybe they're not in max vax clinics, but they're in mobile clinics or closed pods out in the community. So that's a good thing. The other $50 million, we spend it in the community to really pump up the community. $15 million went to the cities to help them with their impacts, because it wasn't just the county that had impacts. We ran about $18 million in business grant programs. We had a couple of $1 million set aside we had the arts and entertainment nonprofits. Really, we had a lot of partners, and those partners were all hurting. And we realized that if we didn't share the money, if we didn't get it in the community, some of the jewels that we have in the community might not make it. So we really invested $50 million. We still have about $8 million of that unallocated, so we have to have a discussion what we're going to do with that.
That's great. Dr. Noguchi, Supervisor Chiesa mentioned the schools would be getting some of this funding as well. And we know a lot of schools across the state are going to be receiving funding for safe reopening plans. How will that funding be used in Modesto City Schools?
You know, I have to say this is a once-in-a-career opportunity, once-in-a-lifetime opportunity. We really have the resources from the state and the federal government to really reinvent our schools. You know, if we look back, we recognize there's some kids that fall through the cracks. There's some systems in place and education and policies in place that are antiquated. So now is the time to really work with our stakeholders, our parents, our community, our students, our teachers, and say, what can we do differently? How can we reinvent what we do to ensure that all of our students are successful? And we've started those conversations in the last couple weeks. First off, with the dollars, it's ensuring that our schools are safe. And so ensuring that we've got all the HVAC systems and all the health mitigation strategies in place to ensure that our kids are safe and our staff is safe as we come back, because we are going to be in COVID for a while. The next piece is really looking at what do we need to do to capitalize on these dollars and the time that we have to go back and really engage our students, not only with learning that they didn't realize, learning loss as some folks put it, but also with mental health supports. And so we're looking at hiring more counselors, more students assistance specialists, which are mental health clinicians, into the schools and actually have them assigned to the schools so that we can have real-time, on-time support for kids that are acting out. And so that's one piece. But another important piece is really taking a look at how do we take these dollars and leverage them so in 2024, when we look back, we look in the rearview mirror, the dollars aren't just gone. We didn't just put them in, we didn't buy a bunch of things, but we really have an investment. And that is, I believe we can invest in our people. We've got 4,500 employees, everyone really taking a deep dive this next 3 years in professional development, not only in the classroom, but also the support services. How do we look at what we do and create the right conditions for all of our kids? And so all of that in addition to really looking at summer schools, intersessions before, during, and after school support for kids with academics and also engagement.
Thank you. You mentioned mental health clinicians, and so I'm going to jump to another question around that. This one came in. What about the mental and emotional well-being of students? Are administrators concerned? How are these considerations shaping the decisions being made? And I know you spoke to that a minute ago, but maybe you could elaborate a little bit.
Certainly. We recognize that is very important. And it's not just important for our students, but it's important for our staff and it's important for our parents. And so there have been strategies in place this year to identify those students that are struggling and then get support to those students. We work with the Center for Human Services and contract with clinicians there. And as we identify students that are struggling, then we make those connections. For next year, we're really looking at, or the elementary school district is putting in a system called MTSS, which is multi-tiered support system, which is really a team of professionals that work with our elementary students in the area of literacy. But part of that team will also have a mental health clinician, so we can, on the daily, address outbursts or concerns that we see with our students, and so we're going to do a deep dive there. Additionally, for our high school, we want to hire additional counselors at the high school level and have additional services through the Center for Human Services. Now, to me, that's outside folks coming in, which is great, but the most important is the teacher. The teacher sees the student, the teacher talks to the parents, and the teacher knows what's going on. So this year, at the beginning of every school year, we have a day of professional development for teachers. That day is going to be focused on how do you, for the teacher and the administrator, how do you identify areas of stress or concern in students or in staff or colleagues, and what are some strategies and what can you do as a result of it? And so we're spending time working with our teachers and administrators in developing those skills and well, but also for teachers that are really stressed and fatigued. There's a lot of fatigue. There's fatigue in this room, right? We're all fatigued. We want this to just be all behind us. And so how can we support ourselves and our own mental health while at the same time recognizing what's in front of us? And so that is the theme for the professional development this year.
That's got to be really challenging. So we'll stay with you for just a second because we know we've seen a lot recently about students trying to get back to normal. And we know there were several students recently who made the pitch for an outdoor prom, for example. What is the district doing to normalize the school experience when it comes to things like prom and graduation?
You know, I think I'm going to answer that in two ways. First, I want to address the prom because that is definitely prevalent. We get emails and calls each and every day at all of our high schools. And first off, I want to say I feel deeply sad for our seniors because our seniors, this started with them in their junior year. So they really have not had a senior year. It really has been hijacked from them. And so as far as the prom piece, there was some glimmer of hope, but I think falsely. A couple weeks ago, the state of California came out with some outdoor guidelines, and it talked about how do you bring folks together in groups of either 50 to 100, and what does that look like? And they just happened to put the word prom in those guidelines. But let's really take a look at those guidelines. This is kind of the bare bones of the guidelines. One, you can only have 50 to 200 kids. You have to have a test, or you have to show that you've had you've had the vaccine. You have to be assigned to a seat. You can't dance. You can't mingle. So basically, this prom that they put on this guideline is a student that can show that they were tested or had the vaccination, and then they would go in and they would sit at a table. That, to me, is a problem because we're not going to be able to keep the kids sitting at a table. That's one. Another piece to that is just equity. We've got senior classes of almost 600, and the most you could do is 200. So where's the equity in deciding who's going to come and who isn't going to come? So that has been really difficult, and so what have we done to mitigate that? And that goes back to how are we trying to normalize? We are hyper-focused at getting kids to walk across the stage. So to do that, we need to make sure that everything we do with our students is that we are doing everything within our powers to mitigate any sort of exposure, because if they're exposed, just like today, there's kids at quarantine for the next 10 days. A week from now, if that happens, they potentially could not be walking across the stage. And in some cases, like an athletic team, the whole team is quarantined. And so we are working with our principals to identify activities that the seniors could still engage in and still honor themselves and each other. For instance, and there's many different ideas out there. I know there's this one where you come in your robe, on your graduation robe, you walk outside on the stage, if you will. You stop in the middle, someone calls out where you're planning to go to college or where you're planning to go to work, what's your favorite hobby, and a sentence or two that you've written about yourself, and then you walk. Then you continue walk, and folks can acknowledge you. Is it where we want to be? No, but it is something, and I do know that our principals and their leadership teams and their student leadership teams are getting very creative, but we're doing it hypersensitive to keeping the mitigation down, because it is alive and well. We are still in red tier, and I know folks don't want to hear that and don't want to acknowledge that, but it is alive and well, and we're really trying to keep that down until after graduation, and then we can breathe a sigh of relief.
Yeah. One more question for you, Dr. Noguchi. Many parents have been concerned about their students' extracurricular activities because of the important outlet they represent. Have students been able to participate in sports and clubs this spring, and what are your plans to bring them back online?
Yes. So actually, that goes back to the dollar, the extra resources that we have as well. So yes, we did CIF and CDPH did come up with guidelines for sports, and sports has been kids have been engaging in sports for about 4 or 5 weeks, maybe 5 or 6 weeks. I know exactly what it is, but yeah, they're conditioning and they're playing games, and that's moving forward, and that will go through the summer as well. And so those will continue as we move forward. My guess is we still will have different guidelines as we either potentially, if we move into a surge or not, there'll be some other mitigating factors that we have to work there. But as far as the extracurricular, the dollars that we're getting in from the state, we really are focused on 2 things. One is the academic side of the house, but really deeply providing experiences for kids with enrichment. I'm going to talk just about our junior highs, for instance, and we really are trying to reinvent ourselves and think outside the box. So currently our junior high schools do not have an activities director and do not have an athletic director. It's not something that we have in our junior highs. Next year, we are hiring folks for those positions, or part for those positions. Additionally, we want to work towards getting tracks at all of our junior highs, and opportunities for teachers to work with their students to identify certain clubs that they want to do. For instance, the robotics club, or the drama club, or different clubs. So there's dollars available for the next 3 years to really be able to engage the staff with the students. So there is going to be a lot of opportunities for kids.
Something to look forward to, for sure. Let's go back to Dr. V and continue our vaccination discussion, because this has been such a hot topic in the early months of this year. The county recently made the decision to close 4 of our large mass vaccination clinics. Can you explain what the plan will be now to get residents vaccinated?
Yes. So as we looked at the use of our larger sites, we weren't using them quite as much as we had been previously. And part of that is, the people who were 65 and older, or 50 and older, or those with underlying diseases who were at high risk for a bad outcome from COVID, they had a sense of urgency to come in and get vaccinated, and they really wanted to get vaccinated, and we wanted them to get vaccinated as fast as we possibly could. But we're into now the people who are not at high risk of a bad outcome from COVID-19. The young, healthy 20, 30-year-olds. And they don't have that same sense of urgency, so they're not coming in as quickly. It's not because they don't want to get vaccinated, it's just not their highest priority. And so as we look to use our resources the best way we can, what we're going to do is make it hopefully easier, move out into the community, do more smaller ones at many different places, and hope that that promotes more people coming in. It is really important still to vaccinate our young and healthy people, ages 16 and older, for a couple reasons. One is they're not completely safe from a bad outcome. There are otherwise healthy people that have been hospitalized and have died. It's rare, that's true, but it has happened. So it's not 100% protective just because you're young. The other reason is that our highest case rate is actually in people 18 through 29, especially females 18 through 29 is who we see the highest case rate in. I actually think that's because more females get tested than males, but it could be they actually have a higher case rate because maybe they gather more social, who knows, maybe the jobs that they have put them in close contact with people, or the way they interact in the family. It's hard to tell, but that is what we see. And we do know that this drives a lot of transmission. If 18 to 29-year-olds were just living in a bubble, it would be different, but they live in communities. They have parents that they visit. They have coworkers that are older and at higher risk. And so they are large drivers of transmission as well. So we really do need to get them vaccinated if we want to really keep transmission low. So it's important for us to change our strategy in vaccination to accomplish this.
Got it. So I've got a couple questions for you that came in from our Facebook followers. One question is, I'd like to hear about how the county plans to increase the rate of vaccination by addressing vaccine hesitancy, increasing access, removing barriers, etc. Can you speak to that?
Yes, so I talked a little bit about that in the last answer. It's really getting out into the community, but it's also a lot of working with people that are trusted, right? People want to hear that the vaccine is good and safe from someone they trust, and that's not necessarily me. It could be your union, it could be your community-based organization, your church, it could be anything that is someone you trust. And so we're trying to partner with many, many different organizations to bring vaccines out into the community in a way that people will be more likely to take them. There's a lot of messaging going on, and there's just very many activities trying to increase acceptance of the vaccines. Like I said, there's been over 200 million, I think it's getting closer to 250 million given in the United States. We know they're safe, we know they're effective. So it's getting that message out through people who are trusted messengers, as they're called. So really getting them out into the community, not making people come to our larger sites, and then all of our messaging.
Okay, another question that came in from social media reads, I'm fully vaccinated for the past 2 months and was exposed to COVID-19. Do I need to quarantine even if I don't have symptoms, and should I be tested?
So the guidance is that fully vaccinated people who are exposed do not need to quarantine and do not need to be tested, as long as they do not have symptoms. So you need to monitor your health, though, for those 10 to 14 days. And then if you develop symptoms, you do need to go into isolation, and you should get tested. So really, the rules are just a little bit different for those who are fully vaccinated, and it's a wonderful thing to see that we know our vaccines are protecting us well.
Thank you, Dr. V. Let's go to Supervisor Chiesa. Can you tell us what some of the things the county has done are to provide additional help to residents who've felt the impacts of the pandemic?
Thank you for the question. And so this is something I'm really proud of. We have our care and shelter branch of the emergency response, and how they've helped individuals and families has just been outstanding. Some people, you have a support system that you can count on. There's someone that can make sure you're eating, that you have enough food, that you have hygiene, that you have your medication. And that's what the Care and Shelter team has been doing. They've been reaching out to people, helping them. And you see in a pandemic like this, you can be a divided community or you can come together. And I've seen the nonprofits and the community-based organizations in the county working more collaboratively than we ever have. And a big thanks to the Parent Resource Centers, which again is like a starting point for most people. I don't want to miss anyone, so I'm going to look down at my paper just to make sure I don't miss anyone. But the Parent Resource Centers, Sierra Vista Child, and Family Services, West Modesto, King Kennedy Collaborative, the Center for Human Services, Aspiranet, and just really how quickly everyone mobilized to fill this need. So I think that's something I'm really proud of, and I think the whole county workforce, we should be proud of them.
I know we've stood up a lot of really impactful programs over the course of the last year as well. Can you talk a little bit about the Emergency Rental Assistance Program, how it works and who's eligible?
Yeah, great program. We stood this up recently. I think it's been about in the end of February. So first of all, the money came in two phases. It's about $36 million. And there's a reason for two phases I'll get to, but the eligibility requirements are that it was from April 1st of 2020 through March 31st of 2021. Any arrears, money that's been accumulated in rent, it can be utilities, and utilities include your gas bill, your electric bill, your sewer, your water, your broadband, or your internet service. The only thing that's not eligible is phone and television service. But the first phase will pay for 100% in arrears of anything accumulated. And the reason that the county is doing it a little different than the state is that there's not enough low-income housing in Stanislaus County. And in talks with the Stanislaus County Housing Authority and others, we believe that if we didn't pay 100% in arrears, some of those houses might disappear. We're not like the Bay Area where there's national firms that have housing. This is mostly mom and pops, people that have one or two houses, so we felt very strongly. Of the total $36 million, about $16 million was in that first phase. I think we've already allocated around $9 million for that so far. The second phase is through the state of California. It's a little more money than what was given to us, and I can tell you that they're only going to pay 80% of the arrears. And they expect in order for a landlord to be paid, they have to essentially extinguish that 20%, which is still better than nothing, but we took a little different approach. To be eligible for this program, there are median income. You can't exceed the 80% of the area median income, which is about and it varies on the size of your family, but as an example, a family of four, it's about $56,000. So that gives you an idea. You can go to the website, stanrentassist.com, Stan Rent Assist, and I think it'll show up on the TV. But go there, start, and you can access that also through the county's website, and I believe through Stan Emergency, but Stan Rent Assist. I tell you that if you have any issues with it, please call my office too. I think this is a very, very, very good program.
Yeah, and a big need in our community. Obviously, we talked a lot about the need to keep people in their houses. One of the most significant growing issues across the state is homelessness. Are we looking at any new strategies as a county to address this? If so, what can you tell us?
A vexing problem as we talk about the housing costs and mental health crisis and everything else. We've seen pretty much an uptick in homelessness. I know we were just doing a strategic plan that is out there. I have to look down and see, but on May 22nd, we're having a community summit from 10 to 12, and you'll see more information on that. But the strategic plan underway is about outlining the barriers and goals and strategies on how to deal with homelessness. A couple of things we have going out in the field. We have an outreach and engagement team that has been out all through the pandemic, and their job really is to meet people on the street, people who are homeless, maybe living in their cars, and try and get them connected to services. And we have again, a collaborative effort with nonprofits and other folks, but they're out there. I see them in my district down in Turlock. They're there once a week. In Modesto, they're out a couple of days a week, West Side, and then the northern area. Again, trying to connect people with the services necessary. And it may be they just need vital records. they may need an ID in order to get a post office box, maybe setting them up for SNAP or CalFresh cards. But it's the first step in the engagement. And then the other thing, we're going to expand our care team, which is the community, let's see, now I'm caught, I'm sorry. It's the Community Assessment, Response, and Engagement. There you go. We have so many acronyms, I'm lost all the time too. But really, this is for the most acute cases. You have people that are the most distressed in our community that might need more help, and think of someone, on the side of the street in cold weather, yelling and screaming with their shirt off, and those people need extra help. So we're trying to send services to them to make sure they're taking medications when necessary, that they may need medical treatment, they might have been released from a hospital and have a wound that needs treatment. So we're going to start expanding. The pandemic slowed the care team down. Because you have a lot more close interaction, but we're going to expand it countywide, and we're pretty excited about that. But again, this is a vexing problem. We continue to look for solutions, and they're just not easy to come by. Our shelter operation, we continue to have the low barrier shelter operation, as well as helping fund the other areas in Patterson and down in Turlock.
Thank you, Supervisor Chiesa. Let's talk about the schools a little bit more. Dr. Noguchi, many of the parents in our community are concerned about what happens after this school year. What is Modesto City Schools doing for summer school? Will there be fun activities over the summer?
Absolutely. So for those parents that are watching and would like to learn more about what we're doing for summer school, on our website, our board meeting, April 19th, we did a presentation for about 25 minutes around all the opportunities that we have for summer. Kind of a Cliff Note version of it is we really redesigned summer school this year. Rather than having summer school at just a few chosen schools where kids then would go to, we actually are trying to get it at every single school and really individualize it for that school. So parents and students may have a different experience at, let's say, El Vista as they would at Sonoma or Lakewood or what have you. So take a look at the website, and there's some opportunities for some information there. We are working on two areas this summer. One is obviously the academic piece, but also we strongly believe the enrichment is essential, and also just getting kids back together, playing together, learning how to interact with each other, and really the whole social emotional piece is very much of a focus this year from TK, so transition kinder, all the way through 12th grade.
Well, that's good news. This fall, do you expect all schools to fully reopen and class sizes to be what they were pre-COVID?
We are planning for a 5-day-a-week educational experience for our kids. So we recognize that there are parents that are reluctant to send their students to a brick and mortar school. So we do have the Modesto Virtual Academy open, as we did this year. So parents can sign their kids up. Again, this one's kinder through 12th grade in that academy if they choose to remain virtual. The state of California at this point has not given us guidance on distance learning. Right now, many parents know distance learning to be the teacher with the students on Mondays and Tuesdays and Thursdays and Fridays, and they're interacting on an hourly basis. That was for this year only. After this year, the legislature would have to agree to more. So at this point, we're planning for 5-day a week. And we are hopeful that we'll have the majority of our students 5-day a week. And then we'll also have Modesto Virtual Academy. And we may have distance learning depending upon what the legislature provides us as far as guidance.
You just answered my next question, so we'll skip ahead. Will staff and students be required to continue wearing masks based on the latest CDC update?
You know, we're always going to go to what the guidelines are, and right now the answer is yes. So we will continue to just follow through with the guidelines, because we know the more mitigation strategies we put into place, the less COVID we'll have. The less COVID we'll have, the more kids that can be in the classroom, and the cycle of learning continues. So long answer to yes.
And then the last one was, do you think vaccines will be required for students in the new school year?
Right now there are some vaccines that are required, mumps and measles and Tdap, and I do not believe, and actually this is probably a question for Dr. V, it's not going to be required, not by Modesto City Schools. That's really a California state requirement. So until they come out with a requirement, Modesto City Schools will not be requiring that, not either for staff or for students.
Thank you. That's good to know. Dr. V, let's go back to you. So the CDC announced this week that since 96 million Americans have been fully vaccinated against COVID-19, those who are protected or fully vaccinated can begin doing some of the things they used to do, like go maskless outdoors. Do you see a risk associated with this because we don't know who is vaccinated and who isn't?
So we know that the risk of transmission outdoor, that's the whole ventilation and sharing air piece. We know that is much, much less than indoors. And so we're big promoters of all activities being outdoors. The last number I saw was 17. So it's about 17 times less risk of transmission outdoors as indoors. Or you could look at it, you're 17 times more likely to get infected with the same exposure indoor than outdoor. So much, much safer outdoors. So I have very little concern about that. It's not going to be 100%, obviously. There will be spread outdoors, but it's so much less than indoors that I am not concerned.
Dr. V, this has been a hard year for all of us, but no one envies healthcare professionals and the toll this public health crisis has taken on those on the front lines. What has kept healthcare professionals encouraged through all of this?
So I think it's the fact that they feel like they're making a difference in people's lives. They're helping people, and that's really a very strong way to feel like you're doing the right thing, you're doing what's good. It keeps you going and it encourages you. And so as we continue moving through this pandemic, we're getting close to the end. We know the end is coming. We have 3 approved and great vaccines. We're hoping in the next 2 to 4 weeks we'll have a vaccine that's approved, Pfizer, for kids down to the age of 12. So that will be great news that will help us and move us more forward towards ending this pandemic. So we're really encouraged that the end is near. We may have one last little bump or hiccup, but we're coming through this. We've come through this as a community, all pulling together. I find that very encouraging, the way people have stepped up and worked together to help each other. So focusing on the good, and then just keep moving forward and keeping that hope alive. That's I think what keeps us encouraged and going.
Thank you, Dr. V. Any last final thoughts from the rest of the panel? Supervisor Chiesa?
So today I went to the Modesto Vaccine Clinic, and I like to do a walkthrough really quick and just talk with the folks that are working in there. And I talked to a gal. She's been retired for 10 years. Public health nurse, and was there working, and I asked her why she was back, and it was exactly what Dr. V said. She's making a difference. The community needs her right now, and that's her obligation, and I was so proud. And I want to leave everyone with the last thought about there's 4,600 county workers, and they all have a job description, and when the pandemic hit, there were people from the sheriff's office working for public health. There's people from the library working in public health. So it's been an all hands on deck, and I want everyone to realize how hard everyone's worked. I couldn't be more proud of the county workforce, and because of the light at the end of the tunnel, I believe we'll be back to normal. And just remember, as you get frustrated, this is our first pandemic too, and we continue to figure things out on the fly. So I'm really excited for what's going to come in a few more months.
And with that, we will call it a night. Thank you to our panelists for being here tonight and providing the community with an important update on the COVID-19 pandemic, information and resources to help us get through this difficult time, and critical guidance to keep our families safe. And thank you to our sign language interpreters for their assistance. And to you at home for sending in your questions. If we didn't get to your question tonight, we'll continue working to answer them in our Stan Emergency social media updates throughout the week. And as a reminder, you can find us on Facebook, YouTube, Twitter, and Instagram. Just search for the keywords Stan Emergency. Stay safe, stay healthy, and stay informed, everyone. Good night.